A troubling article in today's Wall Street Journal related criticism of psychotropic medications to ignorance. What influencers and critics aren't telling you about antidepressants. Or in other words, doctor knows best. But do they? Psychotropic drug research is inadequate to describe it most charitably, and ignorance of child psychological development and developmental psychopathology is widespread among doctors. These circumstances motivate such unsophisticated but financially lucrative notions as attention deficit hyperactivity disorder, ADHD, despite it having symptoms identical to the anxiety and depression which are present in virtually all medical and psychological disorders, and diagnosing youth with bipolar disorder, though its diagnosis requires an adult mental structure which youth lack by definition. These ideas follow such a historic gold standard belief as the efficacy of lobotomy, which destroyed countless lives, including that of Rosemary Kennedy, the oldest sister of President John F. Kennedy, who underwent a lobotomy at 23 which permanently incapacitated her, making her unable to speak intelligibly. This procedure was permitted by her father, Joseph P. Kennedy, to manage her behavioral issues. Electroconvulsive treatment is still being used, though being best described in the title of a book by Peter Breggin, M.D., who has been called the conscience of psychiatry, brain-disabling treatments in psychiatry, drugs, electroshock, and the psychopharmaceutical complex. Motivating this unholy alliance between psychiatry and the pharmaceutical industry is money. The drug companies rake in billions, and most psychiatrists have little training in psychotherapy, with today's psychiatry residents receiving only 10% of the training in psychotherapy compared with 70 years ago, but compete with psychotherapists of other professions. This also explains the huge sums wasted by the government on genetic research, though most mental health conditions have been long understood as reflecting traumatic early life experiences, the lack of a good enough, not perfect, parenting experience. I end with two quotes. In early 20th century America, the diagnostic precursor of attention deficit hyperactivity disorder was minimal brain dysfunction, which a Harvard psychiatrist said was so dumb that only a doctor with minimal brain dysfunction would use it. When working in a long-term residential treatment setting for teenagers which emphasized psychotherapy and rarely used medication, the physician father of a patient described psychotropic drugs as chemical lobotomies. Enough said.